My name's Elizabeth Lomas and I did some ACP training to develop my roles within Neuro Orthoptics. So I have two roles within Neuro Orthoptics with stroke patients as part of the MDT, helping those patients who have vision problems following stroke to rehabilitate, and then also in a new pathway where we're monitoring the health and integrity of the optic nerve in patients with IAH. Now that I have my ACP roles incorporated into my working week, it's much more varied. I still participate in a lot of core orthoptic clinics, so with paediatrics and adults who have strabismus or ocular motility disorders, but it also now means that I'm spending a lot of time down on the stroke ward with the MDT there and liaising with neuro-ophthalmology and neurology in the management of the IAH patients as well.
Okay, Laura, so I'm just going to place this sensor onto your eyelid just to get a little image.
There were a number of things that drew me towards training as an ACP. I wanted to undertake some kind of additional training to really advance my specialist knowledge and skills, but I also could recognise that with those knowledge and skills I would be able to be really innovative in terms of developing new patient pathways and specialist clinics that could really make a big difference to patient experience.
So here we go, Laura. I just put the video on, so that's your eyeball there, and you can see the nerve coming out the back, so that's what we're checking there to see if there's any lumps or bumps inside the nerve.
I've had a real mixture of training to allow me to be an ACP. Firstly, I undertook an MSc in Advanced Clinical Practice at Kiel. It was a really flexible course and I could incorporate some specialist neuro modules into that. But also I've had a lot of on-the-job training, so our ophthalmologists have been really helpful in helping me to develop skills like the slit lamp and the B-scan, interpretation of OCTs and visual fields, and we've also had some input from the neurology team as well in terms of learning about IAH. The four pillars of advanced clinical practice are advanced practice, leadership, education and research. And I had to be quite innovative sometimes to fit those pillars into my orthoptic practice. But with a lot of consideration, I found it's really developed my holistic approach to seeing patients and really embedding the evidence base around my management and investigation, and also in terms of patient education as well. It's been really, really eye-opening. My training's been absolutely fundamental to develop my ability to be within these neuro-orthoptic roles. Without the specialist knowledge and training that I've received, I wouldn't be able to be competent to be managing and assessing these patients. I feel like these clinics and my role as an ACP are really making a big impact already on patient experience and patient satisfaction. We're having a lot of feedback from patients to say that they really appreciate the extra time and explanation that we're able to provide, and that feels really, really rewarding.